The Northern General Hospital is a large teaching hospital and major trauma centre in Sheffield, England. Its departments include accident and emergency for adults, with children being treated at the Sheffield Children's Hospital on Weston Bank. The hospital is run by the Sheffield Teaching Hospitals NHS Foundation Trust, which also runs the Royal Hallamshire Hospital, the Jessop Wing, Weston Park Hospital and Charles Clifford Dental Hospital. History. The hospital was established in 1878 as Fir Vale Workhouse, which contained the Smilter Lane and Herries Road children's homes. By 1967 the site contained two hospitals which had developed from the workhouse, Fir Vale Infirmary and the City General Hospital. This overall entity was then renamed as the Northern General Hospital. Departments. The hospital consists of 6 wings. Many of the older wings are named after significant families and individuals from Sheffield, particularly in the steel industry. Huntsman Building, named for Benjamin Huntsman, mostly orthopedics, but also contains the A&E, Surgical Assessment Centre, SAC, X-ray departments, the theatres, one of 4 outpatients departments, a large dining room and the site's main medical records department. Within the entrance to the Huntsman Building, a Boots pharmacy and shop, a new coffee shop and small cafe are located near the main reception desk. There is an RBS cash machine. Firth Wing, named for Mark Firth and containing CCU, vascular surgery and other surgical wards. Chesterman Wing, named for James Chesterman, the Regional Cardiology Centre. This consists of inpatient and outpatient facilities. Vickers Corridor, named for Edward Vickers, primarily renal and endocrine diseases, well as containing departments of Sheffield Medical School and the Sheffield Kidney Institute. The wing previously housed the SAC, Surgical Assessment Centre, ward before a new Surgical Assessment Unit, SAU, was opened in the Huntsman Building in 2010. Sorby Wing, named for Henry Clifton Sorby, and containing the Renal Outpatients Unit and the Metabolic Bone Centre. Osborne Building, named for Sir Samuel Osborne steelmaker. The Spinal Unit. Brearley Wing, named for Harry Brearley, and containing the respiratory and rehabilitation wards and a dining area. The Brearley Wing comprises Brearley 1, 2, 3, 4, 5, 6 and 7 wings, as well as an outpatient department and a specialized patient discharge lounge which aims to move patients out of the ward and into a comfortable waiting area before leaving via private or ambulance transport. Bev Stokes Day Surgery Unit. The Bev Stokes unit is where day surgeries are carried out, meaning an overnight stay can be avoided for the patient. Critical Care Department contains ICU, Intensive Care Unit, HDU, High Dependency Unit, and POSU, Post-Operative Surgical Unit. This custom-made department was opened in the summer of 2008, costing £21.3 meters. Hadfield Wing, named for Sir Robert Hadfield. This is the latest addition and houses departments to be moved from soon-to-be-emptied wings of the hospital, and a new neck of femur ward. This structure is 6 stories tall and contains a full-height atrium, allowing natural light to enter the wards. As part of the redevelopment, the area around was landscaped. Clock Tower Building, containing dining facilities, volunteers' office, medical secretaries, security, human resources and the hospital's museum. Other buildings. The Longley Centre for Psychiatry, the Oakwood Young People's Centre, Rivermead Unit, Samuel Fox House and the Medical Education Centre for undergraduate and postgraduate nursing and medical training. Macmillan Cancer Unit and 5 outpatients departments. A therapy services OPD for physiotherapy and occupational therapy, and the Hadfield Wing has been opened. There has been a proposal for a multi-story car park to alleviate congestion on the site, helipad and GP services. In June 2016, a new £2 million helipad opened at the hospital. These funds were raised by the Sheffield Hospital charity as there was a need for the helipad to be located closer to the accident and emergency department owing to the hospital's status as a major trauma centre. This replaced the old helipad located directly to the south of the Macmillan Palliative Care Unit. This helipad was deemed unsuitable for an MTC as it was classed as a secondary helipad, meaning patients would be transferred to A&E from the helipad via an ambulance. Within the structure is housed a new out-of-hours GP centre for patients with more minor illnesses. This is hoped to alleviate pressure on A&E and cut down waiting times for patients. Affiliated universities. Sheffield Hallam University, a local provider of courses and training for allied health professionals such as nurses, physiotherapists and paramedics, which provides postgraduate study in professions allied to medicine. University of Sheffield, a local provider of medical and nursing training and postgraduate study. The Samuel Fox Building is the main building for the university within the hospital grounds. Travel. Public transport. The hospital is served directly by First South Yorkshire and Stagecoach Yorkshire buses mainly. There is also a specific service that travels between the two main trust sites. The H1. This service is free for NHS staff. Photo gallery. Sheffield's Fir Vale Workhouse and Old Hospital. Sheffield Hospitals Charitable Trust.